Welcome back. Today we're going to be here at the bench, and today we're going to be talking about our preliminary impressions. The before impression before we get everything all cut, sliced, and prepared down. The reason why we might need a preliminary impression is because we need to make a temporary crown, bridge, or some type of doohickey so that we can protect the tooth or protect the space where the tooth was at before we get the final restoration in. We have a couple different modes of being able to take a preliminary impression, such as if you want to go old school, we can go and just take a nice simple little alginate small mixture and put it in any one of these trays so that we can go and take it. Or we can use another alternative, which is going to be this polyvinyl siloxane material such as alginate or alginate alternative, or this paired open with our gun and a tip is going to be used in a way to go and fill a tray and get that nice and ready for the impression. This is nice, but tends to also be on more the expensive side of everything. One of the more common ways to be able to take a preliminary impression is going to be with a putty type of style, where we have a base and catalyst and a couple scoops that we're going to use to go and make a nice little concoction and impress our teeth. When taking a preliminary impression, the main important thing about this is getting the impression before anything has started. Maybe you came and sat your patient down, explained everything, and gotten the written consent all signed off, and then from there you're just going to go and take this pre-impression so that later on, when everything's nice and cut, we have an image of it to look like before, so we can make a provisional to look like before it was ever cut. Because a lot of this is going to be specifically dealing with the teeth in general, we just need to get an impression of the tooth. Not too mindful of all the vestibular areas or the rugae or the gum tissue or the ridge. We're going to be remaking that little white nugget that sticks out of the pink. So because we have just such small area to be able to impress and work with, instead of using a full palette tray where we typically have our palette right here for impressing, we can switch to a mandibular tray and impress the teeth and forget about the palette area. That's just going to be a waste of material for the most part. Another awesome alternative is going and using a quadrant style tray or an anterior tray, because we might be going and replacing a couple of the front teeth or in the posterior, and this is going to save on material and be great for storage because we have a lot less to store, bag tag, and just put it off in the side in case we need to make another provisional after they go and break, swallow, or chew it off. The main one that we're going to be going over here today is going to be our putty base. Putty here is called vinyl polysiloxane, or VPS or PVS, whatever your doctor is going to be peeving about. And using this material can be very specific to sometimes what gloves you are wearing when you're mixing this, so that it doesn't retard the setting time, making it so that it sets up in a weird way. With this material that we have here, we're going to go and take a look at what the color is. A lot of times they're going to be different in color, just so that we can see the change from one color to the next, so that we know that we have a perfectly kneaded dough. Make sure you inform your patient, just like any impression, that this stuff is going to go in, it's going to take this long before it sets up, and we will take it out in due time. Also probably give them a saliva ejector, because a lot of times these tend to be scented. This one here is a berry scent, perfect to get their salivary flow going and making it so they drool. With that, depending on where you're going to be taking the impression, such as if it's going to be a full arch, you might need a full scoop to fill up the whole ridge, depending on what size tray we're using for this person. If you're going to be filling up a quadrant, possibly you're just only going to need a half scoop when you're going to go and fill this up. There are times where they're just going to go and roll it into a ball, push it over a tooth, and knead it into place and wait for it to set. That's one that we're going to be doing today. So I'm going to be taking about a quarter to a half scoop right here and making sure that it is equal. Make sure you're keeping them apart until you're absolutely ready to get these set in the person's mouth. So I can go and hold these off to the side on my tray until I'm ready to go. Make sure that whenever you're going to be going and doing stuff like this, once you're done with your containers, go ahead and close them and get these nice and binned. Get my patient ready and informed, and from there we're going to go into kneading our material. So with this, you're going to make sure that when you're kneading it, that you don't see streaks. A lot of times it's going to be a lot of streaking. Like right now, we're seeing nice little colors as we're going. And a lot of times it's just a fold and push. I'm going to use a lot of my thumb to go and push and knead this together. And after a while, once we get a majority of it down, we still see our streaks of color. We want this homogeneous in color where it's just a single color overall. So from here, I'm just going to go and roll it into my hand. Now, when you roll it into a ball, it's not really mixing it if you keep on rolling it. You're still going to need to smash it down into a pancake or roll it into a hot dog and then go back into a circular roll. And once you get that nice and kneaded, you can go and flatten it out and check your mold. I don't see any streaks right here. I don't see anything anywhere else. So from here, we can go and use it on our patient. Like I mentioned before, you can take your bit that you have, feed it into your quadrant tray or feed it into whatever else you need to, and we're gonna go and take our impression. In this case, what I'm gonna be doing is going to be impressing a single tooth area without a tray. The way that I'm gonna go do that is make sure you have your patient nice and available. I'm gonna go take my material here, and I'm gonna go and fold it over the patient's teeth, making sure that I still leave it thick all the way around. Once I get it thick on the incisal edge or the occlusal portion, I'm gonna go and fold it over the buccal. Go a little bit into the vestibule. You want to make sure that it creeps over the zenith of the tooth, the edge, the cervical line, and also make sure that you give some love to the lingual and give it a little bit of push. Make sure to leave it thick. You don't want them to have thin ridges, especially once this is thick and set up. It'll hold its position, it will hold its form. If you make it thin, it's going to move and fold away once a little bit of pressure is applied to it. So as we always say in life, the thicker the better. Once we have it in place, some people may instill their patient to go and bite down very gently. You just don't want them to bite all the way through where they're touching tooth to tooth. If you have them bite gently just as so, and it leaves little divot marks right here in the impression, that makes it nice so that we can know that they're set in the correct place as before, and it holds it. And from here we wait. This can take anywhere from 3 to 5 minutes in the mouth depending on what material you have. So we'll make sure to monitor our patient, continue to set up the room, and make sure the doctor's ready for the patient as they come in. A key little thing when being able to see, oh, is this done setting up yet, is to use the little finger technique like we use for our alternate impressions. From here I can just take my nail that would usually be on the other side of a glove, and I can just go and push my nail in. And if it goes and impresses my nail, like this one has done right here, that means it's still taking an impression of the tooth. But if I was to go and do this later on, and it pushes my nail back out, that means it's for the most part set as much as it can be. The nice thing about these impressions too is that we have multiple uses that we can get out of it. Write the patient's name directly onto the impression or onto the bag that's going to handle it, and in case this person needs another crown made, we can go ahead and take another one using this mold. A real important thing when it comes to this is to not take it off too early. This can still mold or deformed impression of the patient's mouth.
A few minutes later.
Now that our time has passed, if we go over here and take a look at our material and we see that our divot from earlier when it was still setting up, well, if I go right here next door to it and put a little nail impression in here like I'm doing so, it doesn't take that impression like it did before. This material, for the most part, especially just in this area, has set up. And a lot of times with our materials, if it's in the mouth, usually it's going to be set quicker than the material that is outside. So this is pretty good to take off. A lot of times when you're going to go and remove it, be careful to not deform it still, in case it's still setting up inside. And we're just going to go ahead and relinquish it from that patient. And from there, we have a relatively impressive impression of our patient's anterior 4 teeth. From this, we can go ahead and move with the procedure, make sure to keep this by and labeled so we can use it on the person, and we go into our next phase of doing our prep. With all that said, check out the other dental videos I have to see what other dental things we're able to do. Make sure to subscribe to see future videos, and see you later.